related to the activities underway regarding establishing a school-based health center in Waukegan. My name is Diane Driver. I'm the Health Services Lead for our district. This evening, over the next 10 minutes, I'd like to explore with you a brief history, how this concept was originated in Waukegan, and an introduction into what school-based health centers are, a brief review of the health issues of the students in our community, and how it correlates with the mission and vision set forth for our district. And then also paint a brief picture of what a school-based health center in Waukegan would look like. Back in March of 2006, Dr. Karen Carlson was the Associate Superintendent of Specialized Services. She hired a staffing analyst to come in and evaluate our district. The results of her report stated that it was evident that the resources and the staffing in our district was not sufficient to meet the needs of our students, and she challenged us to investigate establishing a school-based health center in our district. I must admit that as a lifelong resident of Waukegan, a product of Waukegan schools, a resident here, a nurse in the community for over 30 years, that I didn't understand school-based health centers, but through research and visiting, I began to see the value of them. School-based health centers improve access to health care for the students for both mental and medical health data. It impacts their academic success, and it impacts it in a positive way by reducing absences, by promotions to the next grade, reducing withdrawals and dropout rates, and discipline problems. It also helps with reducing failing grades in classes by the reduction of risky behaviors and tardiness. In the spring of 2007, my initial findings were presented to the leadership team at that time, and approval was granted to proceed with investigating. The new board had directed and had initially spoke with Dr. Batiste about making this one of his goals, which had to be eliminated, but he saw the value in establishing a school-based health center and encouraged that this planning proceed. A planning grant was applied for, and it was awarded in December 2007, and last month the board approved pursuing this business plan, and I applaud you for your proactive efforts. School-based health centers are actually clinics that are located on school grounds. They provide services to improve the physical and the mental health of the children and the adolescents. It offers the support in a fourfold manner: the student, the parent, the school, and the community. Often, all it takes is one caring adult that listens and believes in a team that can make or break the student, makes the difference in their success. Teams are very resilient, but they need to have one person who believes in them. It offers support to the student. It provides a variety of services in a confidential, adolescent-friendly, and safe way to help them to make healthy decisions and ultimately stay and be successful in school. One of the consultants we have been working with established a school-based health center, which was right across the street from a county health department. And she noticed that students were accessing services in her facility rather than crossing the street to the health center. It provides promotes healthy decision-making for the students and helps them to stay in school. When they're in school, they're more apt to receive their education and be successful. School-based health centers also support the parent. It provides needed services for their children. It helps them to reduce lost work time. I was amazed at the number of students who actually came to me as their school nurse asking for a nurse note to give them permission to leave work to take their child to the doctor. I realized the importance of having health services readily available for our students because it was impacting the parents' ability to keep employment. It also promotes the parental engagement in health care and provides family assistance for benefits and supportive services, especially specialty services. School-based health centers also support the school through education. They teach students how to access health care appropriately, how to take care of themselves, and how to collaborate with staff and education, and how to promote health, also at the same time reducing the risky behaviors that adolescents are prone to engage in. Few people have asked, well, do school-based health centers replace the school nurse? And the answer is emphatically no. Both have very unique roles, and each contributes to the student's health, their academic outcomes. School nurses services are driven by an educational model. They provide services mandated by state, federal law, and civil rights. They also provide accommodations that are part of the Civil Rights Act, Section 5 and 4. They have to enforce immunization and examination laws and provide accommodations to help a child succeed by being an integral part of the response to intervention initiative. But once again, school nurses follow the educational model. They put the health component into education to make the student more successful. School-based health centers are a medical model. They have to provide services that are sustainable, that can be billed for. So it's more like a clinic. It's very different from the school nurse. School-based health centers also support the community. Healthy students lead to successful citizens, which leads to a positive, contributing member of their community. By getting the respect that they need and becoming involved and learning how to access health care and being productive members, they're a valuable member to the community. School-based health centers also are proven to save the state as well as the community a lot of money. By reducing asthma hospitalizations between $233,000 to $342,000 a year, they reduce the overcrowding in the emergency rooms. People have seen the articles in the local paper about the overcrowding and problems at our local emergency room. So people are taught how to use an emergency room effectively and how to use a clinic effectively. This will help reduce and also save money. Translates into $2.5 million savings per year. Immunizations translates to a saving of $2.7 million per year by reducing the exclusion rate of children who do not have the immunizations. It increases attendance, and when children are in their seats in class, they're learning. So let's talk a little bit about the health of Illinois children and teens, and then compare it to some of the statistics of our own students in Waukegan. Most of the significant and costly national health problems are caused by behaviors that are established during youth. We're all familiar with these temptations that youth are subject to. The alarming factor, though, is that of all people, the youth aged 10 to 19 are the least likely to utilize healthcare services. And this is ever so relevant or evident in the public health population. In school-based health centers, the disparity between male and female access to healthcare is not seen. Males feel comfortable within the realm of a school-based health center to seek the treatment that they need. On the outside, the ratio is more appropriate, approximate to 90% females and 10% males who access the care that they need at the health department. In school-based health centers, it's more of a 50-50 rate. A lot of people have read the startling statistics about sexually transmitted diseases, and I concur that the females are not getting these diseases all on their own. These males need equitable treatment also. In the state of Illinois, there are 291,000 children who suffer from asthma, but our statistics within our own district show that over the past 6 years, we saw a 60% rise in asthmatics. 54.3% of Illinois students use tobacco products, another risk factor. 46.8% reporting have had sexual intercourse, and in 2006 we reported 111 pregnancies. 28.8% are described as overweight or at risk for becoming overweight. In Waukegan, when we surveyed the physicals of the students entering kindergarten, 5th grade, and 9th grade, we had an alarming 41%, which was high above Illinois' average. Clearly, something isn't working. Something needs to be done.